Good morning, everyone. Welcome to Belmont Manor and Historic Park. On behalf of Howard County Recreation Parks, thank you for joining us for this special commemoration of the Belmont Report.
It really gives me goosebumps to stand before you at the very place, February 1976, where 11 commissioners came together and forged the early ideas for what would later become the world-renowned Belmont Report. Today, the Belmont principles are applied to research across a wide variety of fields, from cancer to substance abuse to mental health, digital technologies, and AI. The principles underscore our engagement in communities and challenge us to continue to put patients and families first.
To understand why the Belmont Report came about and why it was necessary, we have to look back for 40 years, from 1932 to 72. The U.S. Public Health Service conducted what is officially now called the United States Public Health Service study of untreated syphilis in the Negro male at Tuskegee and Macon County, Alabama. And I'm honored to be here, to be a voice for my father and all of those other men who were in that study. I am Lily Tyson Head, and I'm president of Voices for Our Father's Legacy Foundation. The foundation was started by descendants of the men who were in the United States Public Health Service study. The most grievous part of the study, in addition to being lied to, deceived, never informed, was the denial of a medication that could have cured the disease. The Belmont Report is a result of that study. It came about because of the study.
The report's three guiding principles, respect for persons, beneficence, and justice, remain as relevant today as they were when they were first articulated. Every experiment that we do, every clinical trial that we run, adheres to the principles of the Belmont Report. I'm Dr. Jay Bhattacharya. I'm the director of the National Institutes of Health. So first, the principle of respect for persons. When we conduct an experiment, any experiment, whoever we recruit to volunteer for that experiment should know what they're getting into. Second, there's the principle of beneficence. On balance, I want to make sure that what I'm doing will not harm the person I'm recruited. And third, the principle of justice. People shouldn't be coerced into experiments. We shouldn't take economic advantage of people so that they participate in experiments.
Those three guiding principles are what carry us forward even today, almost 50 years later. Dr. Stephanie Herodopoulos, Principal Deputy Assistant Secretary of Health and the Director of National Health Communications for the Office of the Surgeon General. Patients know what to expect. They know the risks and benefits of the treatment, and they know that they are being screened properly due to the applications of the three principles of the Belmont Report.
The Belmont Report helps safeguard the rights and welfare of American citizens who are participating in human research that's funded by the federal government. My name is Natalie Klein. I'm the Acting Director of Health and Human Services Office for Human Research Protections. Over the past 3 months, the Belmont Report has been the #1 most downloaded document off HHS.gov. Nearly 50 years after it was written, it continues to be incredibly influential to setting foundational principles for ethical research involving humans.
I am thankful for the Belmont Report, the ethical framework for all procedures, biomedical research that is done today.
We're sitting here today, a week after the July 4th of the 250th anniversary of the founding of the United States. Everyone knows the Declaration of Independence, everyone knows the Constitution. And so I think 250 years from now, we're going to remember the Belmont Report alongside those founding documents as a central important document in the scientific enterprise, because the principle of human dignity, once it's established, either it stays forever or it's gone forever. And I believe the scientific enterprise, if it's to succeed, must adhere to the principles of the Belmont Report.
Produced by the U.S. Department of Health and Human Services.